Melasma is a very common skin condition that causes brown, grey-brown, or dark patches on the skin. It usually appears on cheeks, forehead, nose bridge, chin, upper lip. Melasma happens because the skin produces too much melanin, the pigment responsible for skin color. Unlike acne or rashes, melasma is not dangerous or contagious. But it can deeply affect confidence and self-esteem. Common in women, people with medium to darker skin tones, individuals living in sunny climates. What causes melasma? Sun exposure. The number one trigger is sunlight. UV rays stimulate pigment-producing cells called melanocytes. Even small amounts of sun exposure can worsen melasma. Important point. Visible light from screens and indoor lighting may also contribute in some people. Hormones. Melasma is often linked to hormonal changes. Examples: pregnancy, birth control pills, hormone therapy. That's why melasma is sometimes called the mask of pregnancy. Genetics. If your family members have melasma, your risk may be higher. Heat and inflammation. Heat from cooking, hot climates, can trigger pigmentation. Aggressive skincare can also worsen melasma. Types of melasma. Epidermal melasma. Pigment is closer to the skin surface. Usually responds better to treatment. Dermal melasma. Pigment is deeper in the skin. Harder to treat. Mixed melasma. Combination of both. Most common type. How dermatologists diagnose melasma. Diagnosis may include visual examination, medical history, Wood's lamp examination. Doctors may also rule out post-inflammatory hyperpigmentation, sun damage, drug reactions. Best treatments for melasma. 1. Sunscreen. Most important step. If you do only one thing after this video, wear sunscreen every single day. Look for SPF 50+. Broad spectrum. Tinted mineral sunscreen if possible. Reapply every 2 to 3 hours outdoors. Topical treatments. Hydroquinone. A common prescription cream that reduces pigmentation. Retinoids. Help skin renewal. Azelaic acid. Good for sensitive skin. Vitamin C. Brightens skin and protects against oxidative stress. Tranexamic acid. Popular modern treatment option. Chemical peels. Can help improve pigmentation gradually. But overly aggressive peels may worsen melasma. Laser treatments. Lasers can help some patients. However, not everyone is a good candidate. Wrong laser settings may worsen pigmentation. Always consult an experienced dermatologist. Oral medications. Some dermatologists prescribe oral tranexamic acid in selected cases. Never self-medicate. Section 6. Skincare routine for melasma. Morning routine. Gentle cleanser. Vitamin C serum. Moisturizer. Sunscreen. Night routine. Gentle cleanser. Prescription treatment. Moisturizer. Avoid harsh scrubs. Overexfoliation. DIY lemon remedies. Strong steroid creams without supervision. Home remedies, do they work? Some natural ingredients may mildly help. Aloe vera. Niacinamide. Green tea extract. But no home remedy works like medical treatment and sun protection. Be careful with internet hacks. Lemon juice and baking soda may damage the skin barrier. How to prevent melasma from returning. Melasma is chronic and can recur. Prevention tips. Daily sunscreen. Hats and sunglasses. Avoid peak sun hours. Gentle skincare. Consistency with treatment. Microneedling with tranexamic acid. A newer approach. Tiny needles create microchannels in skin while tranexamic acid is applied. Benefits. Better drug penetration. Improved pigmentation. Less downtime than aggressive lasers. Glutathione and 4 therapies. Some clinics promote glutathione injections or 4 drips. Evidence for melasma is limited and inconsistent. Many dermatologists do not recommend 4 skin lightening treatments because of safety concerns. Realistic expectations. Melasma is usually manageable, not permanently curable. Goals are lightening pigmentation, preventing worsening, long-term control. Improvement often takes 8 to 12 weeks minimum. Several months for resistant cases. When to see a dermatologist. See a professional if pigmentation spreads rapidly. OTC products are not helping. Skin becomes irritated. You want laser or oral treatments. A dermatologist can identify your exact melasma type and create a customized treatment plan. If you like mediocre, subscribe and share. Thank you.